When it comes to mental health and substance use care, access to trusted in-network providers should be straightforward and reliable. But here's where it gets controversial. CareOregon, a major health organization based in Portland, Oregon, is making significant changes that could limit your options for routine behavioral health services. This shift might surprise many who rely on their flexibility in choosing providers, especially in less urgent mental health situations. Recently, the nonprofit managed care organization announced that starting immediately, its Medicaid and Medicare Advantage MA members will be expected to seek routine behavioral health treatments, such as therapy and medication management, from providers within their approved network. The goal? Streamlining services and managing rising costs amid a challenging financial environment. But this decision also means that non-contracted providers, those outside the approved network, will have their services restricted after the year's end, making it harder for members to access out-of-network care for key services. Specifically, services like individual, family, and group therapy, skills training, case management, and prescriber evaluation and management will now be limited to in-network providers. Some specialized services, such as applied behavior analysis, ABA, day treatment, partial hospitalization, and intensive outpatient programs, IOP and PHP, will remain unaffected by this change. This selective approach suggests CareOregon recognizes the importance of certain interventions, possibly due to their complexity or cost. The organization insists that its current network has sufficient capacity to serve all members affected by these policy adjustments. CareOregon operates two separate plans within Oregon's Medicaid program, Jackson Care Connect and Columbia Pacific, as well as the CareOregon Advantage program for Medicare beneficiaries. According to reports from the Portland Business Journal, CareOregon is the largest managed care organization handling Medicaid in Oregon. The organization has recently announced it will eliminate 150 positions, both filled and vacant, to counteract financial losses and prepare for upcoming changes in Medicaid management. This move aligns with the broader industry trend toward centralization and cost control, but it also raises questions about how these changes might impact member access to comprehensive mental health care. Adding a note of context, the journal highlights that out-of-network providers have historically been paid 40% to nearly double, 95%, what contracted providers receive. This drastic difference in reimbursement rates played a role in the policy shift, essentially reverting to a pre-COVID stance that favored limiting out-of-network reimbursements. Chris Larson, a seasoned senior reporter for Behavioral Health Business, details these developments further. With a background in communications from Brigham Young University and extensive experience covering healthcare since 2016, Larson offers insights into how these policy changes reflect industry-wide trends and the financial pressures on providers and organizations alike. This move by CareOregon might spark a broader debate. Are these network restrictions helping to control costs and improve care quality, or are they limiting patient choices and access, especially for those who rely on out-of-network providers due to specialty needs or personal preference? What are your thoughts? Do you see this as a necessary step for financial sustainability or as a concerning limitation on patient freedom? Feel free to share your stance or raise questions about how this might directly affect those relying on behavioral health services in your community.